thank you very much for attending this seminar on healthcare-related issues. We have three excellent speakers today, experts in the area of healthcare, healthcare providers, insurance, and related issues. And I'll describe them in just a moment. First, let me tell you, my name is Gary Aldrich, and for the last 40 years I've been involved in matters related to liberty. For the first 30 years of my career as an FBI agent, I attempted to take away liberty. And in the last remaining years, I've been attempting to protect and restore liberty. And of course, the liberty I was talking about when I was an FBI agent was taking away the liberty of criminals. And now I am working day and night to try to keep the liberty for law-abiding citizens. And that's what brings me here to this seminar. I believe that, from my perspective, that anytime the government tinkers with private sector entities, especially something as large as healthcare, they are tinkering with our liberties. And we must be very cautious what we agree to sign on to with the government in charge. This is the government, after all, that has been running the Veterans Administration hospitals now for many, many, many decades. And we hear constant complaints about the quality of care for our veterans. And somehow I think people think, well, maybe they're getting less care because... But no, this is the government's best effort to provide health care for some of the citizens who have sacrificed almost everything for the country. So if this is the best the government can do for citizens who put their lives on the line, and in some cases give away most of their health for this nation, then I think we should be very concerned about a government who now suggests that they can run health care to everybody's advantage. This is a wonderful building that we're in here today, and the building and the air conditioning and the lights brought to you by the American taxpayer. The sandwiches are brought to you by CNP Action Inc., the organization that has put this together. CNP Action Inc. is a 501c4 think tank that remains concerned with liberty and freedom and conservative values. We'll say that right out in front. The event itself financially is hosted by a very good friend of CNP Action Inc., Mr. Larry Wolf out of Jackson Hole, Wyoming, who is very busy in the areas of liberty, but he also is very interested in the areas of human excellence and effectively taking care of as many of the folks in the country that he can that can't take care of themselves. So he has an interest in both sides of the issue. We would like to have our presentations lasting around 15 minutes or so, and then we want to shift into questions and answers, which I think both you and the panelists would have keen interest in. I'd like to describe the panelists here. First is Greg Scanlon, who is the Director for Consumer and Healthcare Choices at the Heartland Institute. And Mr. Scanlon organized Healthcare Choices group in 2005 after spending nearly 30 years in healthcare policy and financing, including 12 years in the Blue Cross Blue Shield system, 5 years as the founder and executive director of the Council for Affordable Health Insurance, and many years working as a consultant and researcher for a variety of think tanks and consulting firms. So he has broad knowledge from every possible aspect and perspective of healthcare delivery and insurance and the rest. He is one of the nation's foremost experts on consumer-driven healthcare, insurance regulation, programs for the uninsured, employee benefits, and healthcare financing generally. He's an accomplished writer and speaker, publishing dozens of papers and averaging 36 or so speeches a year, and I guess this would make 37 today. And he writes and produces the weekly Consumer Power Report, which many here have followed, and produces an email letter that's distributed to several thousand readers every week. He's frequently interviewed and cited in the national print and broadcast media as an expert in these areas I've described. Next we'll have Rick Scott, who also has a lifelong advocacy for patients' rights. He's presently chairman of Conservatives for Patients' Rights, Conservatives for Patients' Rights, which educates Americans about the way we can improve health care for the benefit of patients. The group known also as CPR has been running national television and internet ads since March 2nd, focusing on the 4 pillars of healthcare reform, which are choice, competition, accountability. That's an interesting word to use here, isn't it? Accountability. And personal responsibility. Later, the pitfalls of the Canadian and United Kingdom healthcare systems, and most recently, an ad called Federal Health Police, which I think is interesting, kind of interesting, cute there, as showing a bureaucrat telling a doctor and the patient what they can and cannot do. In other words, getting in between the doctor and the patient, which, of course, that's what government healthcare reform is all about, one of the things it's about. So he will give us a great presentation. Incidentally, he's a co-sponsor of Stellantis Corporation, co-founder, of Stellantis Corporation, a chain of 27 urgent care centers, and was the founder, chairman, and CEO of Columbia HCA Healthcare Corporation. So he has a broad working knowledge and an interest in the issues that Congress is about to address. Now, Nina Ocharenko is now Deputy Director of the Center for Health Policy Studies at the Heritage Foundation, and she's been associated with Heritage since 2001. The best thing I like about her bio is the fact that she began her Hill career working for Senator Jesse Helms. That has to be my personal choice in her bio, but this is a great start for her, and she became interested in healthcare-related matters since that beginning of her experience, which include the matters involving the uninsured, Medicaid, prescription drugs, and she has presented before numerous national, state, and professional conferences and has been published in noted publications such as Health Affairs. She has been a guest on dozens of radio and television programs related to health care, and has focused on the state children's health insurance program, and has earned her Heritage Award, the Doctors Glenn and Rita Ricardo Campbell Award, for her expertise and her presentations in these areas. Has made outstanding contributions to the analysis and promotion of a free society. She has served before Heritage for nearly a decade on Capitol Hill, again starting with Senator Helms, working on healthcare issues for Jim DeMint, for Representative Stu Myrick of North Carolina, and received her bachelor's degree in political science from the University of North Carolina, Chapel Hill, in 1994. So we look forward to hearing from all 3 of our panelists, and then we'll open up the session to question and answer. Please feel free to ask as many questions as you can. You are the group who can greatly influence what's about to happen up here on Capitol Hill, and we do appreciate your attendance here today. Greg?
Thank you. Well, thank you, Gary. I appreciate it, and thank you all for coming out and sharing your lunch hour with us. It's a beautiful day outside. I don't know how you could come down in this hole and listen to health policy for a couple hours. I'm going to talk about evidence-based public policy. In Washington, a lot of policy